Welcome to The Explainer. Today, we're breaking down a medication that helps a lot of people breathe easier every single day. It's called Umeclidinium, and it's a really important tool for managing chronic obstructive pulmonary disease, COPD. So let me ask you this. What if your own body was sending signals that were literally making it harder for you to breathe? It sounds kind of wild, but for millions of people with COPD, that's exactly what's happening. So how does a medication step in and, change the message? Let's dive in. Okay, so before we can really appreciate the solution, we have to get a handle on the problem itself. Let's zoom right into the lungs and see what's actually causing all this pressure.
This word right here, bronchoconstriction, it sounds complicated, but the idea is actually pretty straightforward. I want you to picture your airways like little flexible tunnels. Now imagine the walls of those tunnels squeezing inward, tightening up, and making that tunnel way narrower. It's suddenly really hard for air to get through, right? Well, in COPD, that's what's happening, all thanks to one very specific chemical signal from the nervous system.
All right, so if the big problem is a rogue signal that's locking down the airways, then the mission becomes crystal clear. We've got to block that signal. And that is exactly what Umeclidinium is designed to do. It's a really elegant strategy. So you've got this chemical messenger, acetylcholine, and its job is to deliver a tighten-up order to the airway muscles. To do that, it has to connect to a special docking station called an M3 receptor. Well, Umeclidinium basically swoops in, gets there first, and parks itself right in that docking station. Now, acetylcholine can't land. The tighten up message, it just never gets delivered.
And this is the end game. This is what it's all about. Without that constant tighten up signal hammering away, the muscles in the airway walls can finally just relax. And that widening effect is called bronchodilation. For someone with COPD, that feeling is everything. It's what makes every single breath just that much easier.
So we know how it works when it gets to the right spot. But for a drug to be really effective and safe, its whole journey through the body matters. So let's trace the path of one dose all the way from the inhaler to when it leaves the body.
You see, inhaling the medicine is just a brilliant delivery system. You're putting the drug right where the problem is, in the lungs. Now, a tiny bit might get into the bloodstream, but the liver takes care of that pretty quickly and then it's cleared out. This targeted approach means you get the maximum benefit right where you need it with minimal effects on the rest of your body.
Now think about this. For a maintenance drug, one you take every day, how it works is only half the story. The other half is, how long does it last? And that brings us to this number, 30 hours. That's the effective half-life of Umeclidinium.
And that long half-life, that's the secret sauce. That's precisely why we call this a long-acting medication. It doesn't just work for a couple of hours and then disappear. No, it sticks around, blocking those receptors, keeping the airways open around the clock. And that's what makes it possible to take just one simple dose a day for all-day relief. So, because it's long-acting, it has a very specific job. You have to think of it as a daily maintenance tool. And that means it's super important to be clear about when you should use it and, just as importantly, when you absolutely should not.
Okay, this might be the most crucial point to understand. Umeclidinium is like your shield. You use it every single day to prevent the airways from tightening up in the first place. A rescue inhaler, on the other hand, that's your sword. You only grab that for a sudden attack, to fight back and quickly open things up when you're really struggling to breathe. They have two totally different jobs.
And like with any powerful medication, we absolutely have to talk about the safety rules. It's vital to know the potential risks and warnings, so let's get into it.
And here it is, in black and white, straight from the official guidance. This is not for an acute attack. This just confirms what we talked about with the shield and the sword. Umeclidinium is just too slow to work in an emergency. You have to, always, have a fast-acting rescue inhaler ready to go. There are also a few specific conditions to be really careful with. So the powder in the inhaler has milk proteins, which means it's a no-go for anyone with a severe allergy. Also, because of how it works on the nervous system, it could make things worse if you have conditions like glaucoma or issues with urinary retention. These are all really important things to talk through with your doctor.
Now, for most people, the side effects are pretty mild and stay right where you use it. Things like a dry mouth or a sore throat. But, and this is a big but, you have to be on the lookout for the more serious warning signs. Any new eye pain, blurry vision, or any trouble urinating, those need to be reported to a doctor right away.
All right, we have covered a ton of ground here, so let's pull everything back and just distill it down to the absolute must-know bottom line takeaways.
Seriously, if you walk away remembering just a few things, let it be these three. It's a daily, preventative shield for COPD. It works by blocking that tighten up signal. And it is never, ever, ever a substitute for a fast-acting rescue inhaler during a breathing emergency.
You know, this whole idea of finding a specific problematic signal in the body and then designing a molecule that's a perfect key to block its lock, that's a huge part of modern medicine. It really makes you wonder, what else could we treat this way? When you think about autoimmune diseases or even neurological conditions, the potential for this kind of super-targeted therapy, well, it feels like we're just scratching the surface.